Hello everyone, welcome back for another video. Today we are actually going to be going over the axial skeleton. Now, in general, when we first begin to talk about the skeletal system, we actually have it divided into two distinct regions. We have the axial skeleton, which consists of the more central components. There we go. More central components kind of working our way down the center. That's going to include our skull, our thoracic cage, as well as the vertebrae that are supporting the skull. The other half of the skeletal system is something we'll be exploring next week. That's going to be the appendicular skeleton. So, when you think of skeleton, I want you to think of appendages, right? Our appendages are the upper and lower extremities, the arms and legs, and that's going to be consisting of the appendicular skeleton. But like I said, today we're going to be focusing on the axial. Here we go. Go ahead and get my pen ready. Perfect. Now, when we're first taking a look at the skull, we have a few differences between cranial bones and facial bones. The cranium is pretty much consisting of all of the bones that are primarily have the purpose of protecting the cranium or like the brain. And then our facial bones are pretty much going to be everything that's lower, more aesthetically pleasing features, and more for muscle attachment. With regards to my quiz and my exam, I do not often ask about cranial and facial bones. I more so just kind of use it as like a way to start to introduce things. Now, when you first begin learning about the axial skeleton and especially the skull, one of the best methods to go about it is to have something that's really nice and color coded, kind of like this. This color coded skull lets you see the boundaries for where every bone begins and where every bone ends, and this makes things significantly easier when you're first kind of introduced to these bones, because the skull is made up of so many different bones, all of different shapes and sizes, and it can get a little hectic, it can get a little confusing. Now, the first bone we're going to look at is the frontal bone. Sorry, this is going to happen a lot. I don't know why PowerPoint hates me. Our frontal bone, if we think back to week one, we described the frons or frontal region as generally referring to the forehead, and in this instance, we can also be referring to the frontal bone. It's pretty much taking up the entirety of your forehead from down to your eye, all the way up to the center portion of your head. Back here we have the parietal bone. The parietal bone is going to be this pale looking color. There's going to be actually a left and a right parietal bone. So even though there's only a single frontal bone, the parietal bone is actually going to be split into a left and right. And we'll kind of get into a little bit more of that later on as well. The occipital bone is going to be comprising the entirety of the posterior aspect of the skull, pretty much protecting the backside of the skull. And again, there's only going to be one occipital bone. And then finally we get down here to the temporal bone. The temporal bone is going to be making up pretty much the rest of our cranium. The temporal bone is going to be found on these lateral sides. There's going to be a left and right temporal bone. So just like the parietal bone, temporal bone will also have two different bones to it. A way that I like to actually remember, how do I remember temporal bone? Is if you've ever had a headache and somebody had told you, oh, just rub your temples, or if you've rubbed your temples during a headache, this is often the temporal bone, generally that region. The temporal bone is fairly important because it actually connects to our mandible. Our mandible is the lower jaw that has all of our teeth, and this is actually going to connect right here at this temporomandibular joint. It's a fairly important joint because this is actually what allows us to kind of move our jaw up and down and kind of allow us to chew. As opposed to the upper jaw, which is consisting of the maxillary bone, this green portion here, this maxillary bone is completely immobile. It's completely sutured in with the rest of the skull. The only reason we're able to move our mouth and chew is due to the mandible. Now, for some of these bones, I actually do want to come back to a little bit later on, including the ethmoid bone and the sphenoid bone, just because they're especially irregular, so we'll come back to them a little bit later on. Let's take a look at the zygomatic bone. So the zygomatic bone is actually making up your cheeks, essentially. And what's really cool is that you can actually feel the zygomatic bone on your face yourself. And that's often what makes this quiz and exam one of the most entertaining ones, at least for us instructors, because as we kind of observe the various students kind of completing their questions, you see a bunch of students just kind of like moving their body around, feeling the different bones that you have on your own body, and this actually can be a very good and resourceful tool for yourselves. That's obviously not something we can take away. We can't take away your bones, so it's pretty cool. For our nasal bone, nasal kind of implies that it's going to be of the nose, right? That little section right there. Now, people often get a little bit confused about the positioning of the nasal bone. They often think it's a little bit lower than what it is. The majority of your bone is just pretty much this elastic cartilage tissue. So, in order to kind of properly assess where the nasal bone is, if you've ever worn glasses or sunglasses, where your glasses and sunglasses are sitting on top of, that would be approximately your nasal bone. So, much further up on the superior point of the apex of your nasal cavity here. And then finally, for this image, we have the lacrimal bone. Now, the lacrimal bone is often associated with our lacrimal gland, and that's how I'm at least able to also kind of think of it, because our lacrimal gland is what produces tears. Now, the lacrimal bone is actually where our tears are going to drain inside of. So that kind of gives you an easier understanding that the lacrimal bone is going to be in the medial aspect of the orbit of the eye, and this is where our tears are essentially going to drain into. Taking a look over here, this is pretty much all of the bones once again that we've already seen. However, we also have the included palatine bone. Now, this image here is actually very, it's like the worst way to represent the palatine bone, because the palatine bone is so much more significant than just that posterior aspect. Best way to talk about it is to refer back to the maxillary bone. So the maxillary bone makes up our upper jaw, right, part of our hard palate. And then as we continue into the posterior cavity, our maxilla eventually kind of transitions into the palatine bone, and the palatine bone is going to make up the posterior aspect of the roof of our mouth. So that's honestly the best way to go about describing it. Alright, looking at this image, we're looking at the top of the calvaria. So whenever you see me mention that term calvaria, calvaria typically refers to the skull cap, right? So if you're using your skull models and you have like this little small dislocated portion that you can pull the top off, that's going to be your calvaria or your skull cap. Now, the first thing I like to do when I'm looking at a slide like this is I like to reposition myself into a posterior and an anterior aspect. So all the way back here by the lambdoid suture, this is going to be our posterior side, denoted with a P. And then all the way over here where the frontal bone is, this is going to be the anterior side. So we now have an anterior and a posterior aspect that we're actually properly viewing this image from. Now let's go ahead and start with our frontal bone, because that's pretty familiar already. The frontal bone, getting a good look from the superior view, is going to be divided by our coronal suture. And our coronal suture is essentially breaking apart the frontal bone with the parietal bones. So once again, we have a left and a right parietal bone. This coronal suture is pretty much all of these guys kind of moving across. Now, when you normally think of a suture, right, you think of if you have a deep cut or a laceration, you go to the hospital and they suture you up. A suture is just referring to essentially a fusion of two different tissues. And in this case, our bones also have natural sutures that are a fusion of two different bones. You might also come across the term articulation. Articulation is a really fancy word that just means pretty much two bones are touching. So we don't have to really worry about that. Anyways, our coronal suture is very easy to remember because our coronal suture can actually follow the exact same coronal plane back when we learned in week 1. So in week 1 we learned about a coronal plane, slash frontal plane, we learned a transverse plane, and we learned a sagittal plane. So the coronal suture was what divided the body into a anterior and posterior half, and that's exactly what our coronal suture is doing. Our coronal suture is doing the exact same thing, kind of like dividing the anterior and posterior aspects of the skull. And just like I previously mentioned, we also have a sagittal suture. Sagittal suture is going to follow the sagittal plane right down the middle of the skull. The sagittal plane is running and dividing our bodies into a left and right half. Moving all the way back down, we have the lambdoid suture. The lambdoid suture is going to be this squiggly guy in the back. We're actually going to see a better image on the next slide. He's actually going to be dividing our occipital bone and our parietal bones. Now what's especially interesting is that this kind of junction that you see here between the Lambdoid suture and the sagittal suture, and the sagittal suture and the coronal suture, these guys actually have some unique names. So we're going to call this guy on the anterior side the bregma, and we're going to call this guy all the way back here the lambda. And that's just denoting where the two sutures are meeting. So once again, we can actually see this is our occipital bone divided by the lambdoid suture, with the parietal bones on either side and the sagittal suture running down the length of the skull. So what's actually pretty interesting is in the Greek alphabet, we have this little character right here, lambda. You may often see this in physics and related to concepts of wavelength and frequency and speed of light and that kind of fun stuff. And pretty much anatomists, when they first looked at the back of the skull, they said, hey, that kind of looks like, you know, this shape right here. And as you can kind of see, it has a little bit of the same kind of designation. So that's why they decided to call this whole structure back here the lambda. Alright, so taking a look at these guys, there are a few different structures here. There's going to be our anterior, middle, and posterior cranial fossa. These guys are just what they are. A fossa is like a shallow indentation into the bone. And the anterior and posterior kind of gives away which side is which, so we can do anterior and posterior. Now, for my pre-med students, I actually do make them memorize all of these foramen to make sure that they know what's up. For my 201 classes instead, we're just going to focus on just a few of them. So what we will be looking at is the optic canal. The optic canal is going to be these two small circles right here. Now, normally when you think of the term optic, you're thinking of, eyes. And the optic canal is actually what is going to allow for our vision to occur. So the optic canal is going to actually allow for the nerve that controls our vision, the optic nerve, to travel into the orbit of the eye where your eyeballs typically are. So that's going to be our optic canal. Now you may also see this term foramen. Now the term foramen, canal, fissure, meatus, these are all generally referring to one aspect or one specific structure. A foramen just means a hole, right? It's a super fancy word that just means a hole. And the reason why we have these holes in the skull is for one primary purpose. We want to allow for the passageway of nerves, arteries, and veins. So we obviously have a lot of different structures secluded in the skeletal system and secluded around the skeletal system, and in order to access them through our nerves, arteries, and veins, we have to pass through these foramen, these canals, these fissures, and all this other kind of stuff that we need to get into. You don't have to know this foramen ovale. I was just kind of using it as a random example to show you that it's just a hole that allows for arteries, nerves, and veins to pass through. Moving on, let's see, I do want you guys to know about the internal acoustic canal. So the internal acoustic canal is going to be these two short holes on the left and right side. So let's go ahead and break this word up. Internal means inside. Acoustic generally refers to music or sound. And a canal is just, once again, just an elongated hole, pretty much, a longer foramen. And what this allows for us is actually the nerve that controls our sense of hearing. So as you can actually see, if you were to travel directly laterally, this would be the approximate association of where your ears would be. And honestly, I don't really know how to draw ears, so I'm just going to draw little kidneys. Right, that's close enough to an ear. As we move our way down, we have the foramen magnum. So hopefully the first thing you think of when you think of magnum is big or huge or large. The largest hole in the skull is going to be the foramen magnum. And this is actually going to allow for the passageway of our spinal cord. Now coming back up here, we can actually see this titled labeled the crista galli of the ethmoid bone. Now this small section that I kind of created, this little red section here, is actually going to be our ethmoid bone. So our ethmoid bone was a bone that I previously mentioned was very awkward, right? It's like a very irregular sized bone, or very, very irregularly shaped, not size. So sitting in this little compartment is going to be our ethmoid bone. Everything outside of it, this is all frontal bone. But this little square right here, this little rectangle, this is ethmoid bone. This ethmoid bone actually projects down into our nasal cavity and will also pop up into the anterior cranial fossa. Now, what we're looking at here is the crista gale of the ethmoid bone. The crista gale is this little horned structure right about here. The crista gale is actually in charge of anchoring down the brain. So our brain is naturally kind of floating around in these fluids. And in order to make sure that we're not getting a concussion every few minutes, we actually have this crista gale to hold the brain down, make sure it's not bouncing around everywhere. You may also notice a lot of these different tiny holes right about here. All these little guys. All of these guys are known as olfactory, wow, that was the best handwriting I've ever had on PowerPoint. That's amazing. Olfactory foramina. And there it goes. So foramina is just a term that refers to the plural form of foramen. So you can call it foramen or foramina. Either way it works. And the term olfactory generally refers to our sense of smell. So this kind of makes sense now. Our ethmoid bone exists inside of the nasal cavity, and all of these holes that allow for the direct communication to the brain inside of the skull, this is actually going to allow for the passageway for our sense of smell, or for the nerves that control our sense of smell. Whoops, there we go. So we are going to have to know these olfactory foramina. So olfactory foramina, optic canal, internal acoustic meatus, as well as foramen magnum. Taking a look at this is a lateral view of the skull. Oh, you know what? I actually did forget one little thing here, and I'm going to go ahead and erase it just so it's a little bit neater. So I mentioned the ethmoid bone, but there was one other bone that was also very awkward. Maybe I erased a little too much. Another bone that was also a little awkward was our sphenoid bone. So approximately this entire middle cranial fossa, all of this right over here, this is all going to be our sphenoid bone. Our sphenoid bone takes up the entirety of the middle cranial fossa, and situated in the center of the middle cranial fossa in our sphenoid bone is going to be this sella turcica. So the sella turcica translates as Turkish saddle because it looks like a little saddle right about here. And this is actually going to house what is known as our pituitary gland. It's a small little organ, part of the brain, that actually controls all the hormones in our body. Make sure we're in homeostasis. So pretty much sphenoid bone is often described as a butterfly. And you can kind of see it's got like some greater wings over here. Some of the lesser wings are a little bit lower. And overall, kind of gives you the vibe of a butterfly. Now, once again, you can actually see the outline of the sphenoid bone. Once again, very awkward. There's that little Turkish saddle, right? That little indentation there. And then you can see our ethmoid bone as well, projecting down into the nasal cavity, as well as the anterior cranial fossa. Now, the reason why we're actually taking a look at these is because we're actually going to talk about the paranasal sinuses. Now, the first thing we should probably do is kind of break up this word, even though it's looks like PowerPoint did a good job for me already. Para is going to generally refer to around. Nasal is generally going to refer to our nose, right? And then sinus. So when we're describing a sinus is described as a large and hollow, well, not necessarily large, but a hollow and open area, something that is not dense. And we actually have 4 of our bones that consist of the paranasal sinuses. So that's going to include our frontal bone, with what you can see is the frontal sinus, right? They're just named after the bone that they're found in. So we have a frontal bone, the ethmoid bone, the maxillary bone, as well as the sphenoid bone. So these 4 bones are actually going to be part of the paranasal sinuses. Now, that means that these 4 bones actually have some hollowed out portions of themselves. And there's actually going to be 2 primary reasons why that's going to be occurring. The first reason why we have these hollowed out portions is to make the bones less dense, and also to allow for an easier time to move our head so that it's not as heavy. So this allows us to keep our posture a little bit more straight. The second reason is because inside of these sinuses is actually where we have our mucosal cells. So generally when we think of mucus is something that's going to stop and protect us from pathogens like bacteria and viruses and all that kind of fun stuff. Now our mucosal cells actually are going to produce this mucus that will stop these cells. So that's another reason why we have these hollowed out portions. If you've ever heard of a sinus infection before, right, it's a pretty common term. A sinus infection refers to any of these four bones pretty much getting infected. Taking a look at this, there are a lot of different structures that we can kind of take a look at. And there's going to be a few that I'm going to point out, but everything that's found on your Word document is generally going to be considered fair game. I just want to point out some of the more confusing ones or some of the more interesting ones. Now, first up, this little aspect right here connecting the temporal bone with our zygomatic bone. This is known as the zygomatic arch. So I'm going to go ahead and break this word up. Zygomatic arch. So we can see that right there, that's our zygomatic arch. Now connecting the zygomatic arch is going to be our temporal process of the zygomatic bone and the zygomatic process of the temporal bone. And yes, I did say that correctly, even though it sounds a little weird. The temporal process and zygomatic process are not on the bones that you would expect them to be. They're actually going to be flipped. So these processes are more so describing where they are going rather than where they are coming from. An easy analogy that I like to kind of combine with it is to think about a highway that's connecting between the United States and Mexico. So let's say that you are in the United States and you're taking a look at this highway. You would typically call this the highway to Mexico, right? Even though it's in the United States. If you have a friend in Mexico and they look at the same exact highway, they would say, oh, that's the highway to the United States, even though he's in Mexico. So that's kind of like the same kind of situation we're going for here. We have the temporal process of the zygomatic bone. So on the zygomatic bone itself is the temporal process. And then on the temporal bone would be the zygomatic process. A few other things we got here are the mastoid process. So the mastoid process generally refers to this bony projection kind of sticking out right over here. We also have a styloid process. So the styloid process is a very sharp, almost icicle-like kind of sharp poke. Taking a look at the mandible, I do want to break down some of the mandible points. Right about here, this point on the anterior side of the mandible, this is going to be known as the coronoid process of the mandible. So I'll try and spell that for you. Coronoid. Alright, yeah, my handwriting is just not doing too well with the mouse right now. So this would typically be known as the coronoid process. I'm sure we'll be able to see it somewhere else on the slide coming up. Down here we actually have our mandibular condyle, or the condylar process. This is going to sit inside of our mandibular fossa. This is going to be the actual point of contact of how the mandible articulates with the temporal bone. So this coronoid process up here, this guy's not actually touching anything. He's just used there for muscle attachment. This small groove between the condylar process and the coronoid process is known as the mandibular notch. We also have two small portions real quick. Let me erase this arrow. We also have these two portions right quick. This guy and this guy. So, typically referring to the actual complete weight of the mandible. This guy that's going horizontal, this is going to be the body of the mandible. And this region that's going vertical, this is going to be known as the ramus. So an easy way to kind of remember this, anytime you are studying anatomy, the ramus is often referred to as a vertical projection. So whenever you see a vertical projection, that's going to be the ramus. Now what we're looking at is an inferior view of the skull. So let's go ahead and break this up again once more. We have the anterior side, and then down here we have the posterior side. So once again, everything that's on your terms list will be considered fair game, but I do want to point out some pretty cool structures, like the occipital condyle for one. The occipital condyle is going to be, oh man, that's nice. Come on, PowerPoint, work with me. So these occipital condyles on the left and right side are part of the occipital bone, as implied by the name. These occipital condyles are actually what are going to allow for the skull to articulate with our vertebrae, with our backbone. This is actually how the skull is going to be able to maneuver around with that. So I just wanted to kind of point out the occipital condyle. Here we can see the styloid process once again. Mandibular fossa, that's the process we talked about where the mandible actually articulates with. Zygomatic arch, we've seen that guy before. Let's see, palatine bone, we can actually see a stronger outline of what the palatine bone looks like now. Lesser palatine foramen, everything else is pretty straightforward. Alright, so taking a look at this, what I actually want to point out is the bony nasal septum. Now, if we break up this word, bony implies that it's of bone. Nasal refers to the fact that it's in the nose, and septum actually translates from the Latin as wall. So bony nasal septum is going to be the bony wall. Now the bony nasal septum is actually split in half. If we were to make a line just like that, cut it across, there are two bones that are contributing to this bony nasal septum. There's going to be the perpendicular plate of the ethmoid bone. That's going to be this superior half that we can see right here. Right, and we've already previously described this as the ethmoid bone, because the ethmoid bone has to go into the anterior cranial fossa, which is right about there. And it would be arguably much harder to do it from a bottom-down view. Right over here, this inferior portion of the bony nasal septum is actually part of what is known as our vomer bone. Now I'm going to go ahead and erase some of those marks that I made because I actually need to get back in there. For two other major structures that I want to point out. We have our middle nasal concha, and we have our inferior nasal concha. And I'm going to go ahead and erase that too, that arrow, because that's going to get a little confusing in a second. Alright, so these concha are essentially referring to these bony projections that are sticking out of the nasal cavity. You guys can kind of see this just a little bit. Now we have an inferior nasal concha, we have a middle nasal concha, we also have a superior nasal concha, though I very much doubt that you'll be able to see them on the models that we have in the class. Therefore, no identification questions for you guys on the superior nasal concha. But middle nasal concha and inferior nasal concha, those guys are more than enough of fair game. Now, the reason why we have these bony projections kind of sticking into the nasal cavity is because we actually want to warm and humidify the air that's actually coming in to our body so that it's easier on the respiratory system. So as the air kind of travels through directly into our nasal cavity, it starts to become a lot more turbulent, which means that these air molecules are starting to bounce into each other a lot more. That's basically what the warming and humidifying process does. Easy way to remember this is if you've ever done some exercise, anything long term, and you've ever had issues, or not issues, but if you've ever been exercising and you had a parent or coach tell you, oh, you should breathe in through your nose and out through your mouth. The reason why is because these concha right here are going to create that warm airflow. Versus if you're breathing in through your mouth, you just got that cold air that's kind of harsh on your respiratory system. Now, one other thing to point out is that the middle nasal concha and the superior nasal concha that we mentioned that we can't see, those actually belong to our ethmoid bone. Our ethmoid bone actually has the superior and middle nasal concha as a part of it. On the other hand, our inferior nasal concha is actually its own separate bone. So it does not exist as part of any other bone. It does articulate with a lot, but it exists as its own separate bone. So once again, we've pretty much gone through the majority of this. This is just referring to the orbit of the eye. The only thing that you would have to identify from this angle is just that optic canal right there. But we've already previously described that. Alright, to the infant. Now, there's actually only two major structures I want to point out for the infant skull. That's going to be the anterior fontanelle and the posterior fontanelle. So the anterior is referring to the front side, and the posterior is referring to the back side. Now, fontanelle, normally we think of the term foramen. A fontanelle actually has these kind of open reddish triangles. This is hyaline cartilage. So this has not become bone yet. This is potentially about to become ossified as the skull grows, but at the moment this is considered a excuse me. This is considered a soft spot in a baby. So these anterior and posterior fontanelles are considered soft spots in the infant. And the reason why we have these soft spots is actually because of how human brains grow. Our brains actually grow significantly in a massive size as it comes out of the birth canal as we're birthed in order to continue growing. But pretty much these are just referred to as the soft spots. And yeah, quick identification. So what I'm going to go ahead and do is I'm actually going to go ahead and make a separate video for the vertebrae, just because I know that the way that people's attention spans work, you guys like shorter and chunkier videos rather than like one long one. That seems like insurmountable to surpass. So I'm going to go ahead and end this video here, but stay tuned for the vertebrae.